Hello, this is Dr. Kelly Blodgett, a biological dentist in Portland, Oregon, and you are listening to the Talk Healing to Me podcast.
Today's episode is a really juicy one. Dr. Kelly J. Blodgett is a general dentist, but also an integrative, holistic, alternative dentist who is so informed on toxicology, the effects of dental and oral health on the rest of our body. And I learned so much in this podcast that there was a couple of moments that I was lost for words. However, I wasn't lost for words at the end when it sounds like I keep interrupting him while he's speaking. There was a little bit of a lag in our connection, so please do excuse that at the very end. It's kind of funny. Anyway, I hope you enjoyed today's episode. Please do share it with anybody that you know that it will make a difference to. You never know who needs to hear this at the right moment, so please do go and share it. And if you can, give us a subscribe, give us a rating, and let's get this out to whoever needs to hear it.
Welcome to the Talk Healing to Me podcast. Today we have Dr. Kelly J. Blodgett. Dr. Kelly is a general dentist who is board certified in the naturopathic medical dentistry and integrative biological dental medicine and is one of the most unique dentists in the world. At the age of 21, just prior to earning his bachelor's degree in psychology from the University of Oregon, he felt called by God to become a dentist. The specific calling he heard was to, in inverted commas, reverse the negative stereotype of dentistry. Since becoming a licensed dentist in 1999, the year I left school, he has positively impacted hundreds of thousands of people worldwide through the care he provides in his clinic. And through his social media posts, you'll see me brilliant on Instagram, media post series called Toxic Tuesday and Wellness Wednesday. So Dr. Blodgett has performed hundreds of presentations on progressive dental concept over the past 20 years. And has been featured on guests, dozens of podcasts, webinars, news segments, and loads of other interviews. And I love his approach of connecting with the human being first, really focusing on their health goals as the guideposts to treatment. And it's a really refreshing shift from the doctor's knows best dogma of other practices. Dr. Kelly J. Blodgett, it is so great to have you here. Welcome.
Thank you, Karen. It is such a pleasure.
Yeah, it's really great. You know, we were having a chat before we came on, and one of the things you said was how connected the rest of our health is to our oral health. This was the main reason that I invited you on, because I only know a little bit, but sure. I certainly don't know so much more than I do know. Talk to us a little bit about what you do. How is it different from normal dentistry?
This podcast is for educational purposes only and is not medical advice. Always consult your doctor. Views shared are personal and not a substitute for professional guidance.
Sure. Well, and I want to acknowledge the truth that you just shared, Karen. I mean, as a graduating dental student, in 99, like I knew very little, right? So it's our culture and our training, both professionally and socially around oral health, is focused on try not to eat sweets, brush your teeth and floss, and somehow you're going to miraculously not have any issues. Yet that's very few people's experience. So somehow there's a massive disconnect between what people are being coached to do and what they're experiencing. And then that leads to all of the symptomatic management issues that we see in dentistry, right? Like so much of what I would consider like Western healthcare, here's a symptom in our world, dental world. Let's look for holes in teeth. Oh, there's a hole, drill it, fill it, bill it, and rarely are we spending significant time getting to the bottom of why it started in the first place. So, I mean, I could go on for hours about what is different about my practice. And I will say this, Karen, it has taken me 21 years to get to this point. And next year, I hope to be doing even more than we're doing today to better serve our guests. So I'll give you a kind of a general overview that I think is so different about our practice style. Number one is, and it goes back to those core principles that I learned as an undergraduate student, working hard to get my degree in psychology, which is that the human being matters. I was working hard to, my vision in college was to become a psychologist. So one of my jobs in dental school is working on a crisis line And, talk about trial by fire, and learning fast. I mean, when people are calling you in stress, urgent stress, like trying to use words, language, listening skills to kind of quell the emotional issues that are arising, which sounds a lot like dentistry, right? When people go to the dental office, they are often in a state of stress or for some people panic, frankly.
Mm.
How do we reshape what that looks like? So, like in our practice, one of the most unique things we've done is when new patients come in, we set aside an entire day, 1 day per week, where we don't do any dentistry clinically. All we do is see new patients. Currently, we see like 14 new patients every Monday. And it has really, it's completely reshaped how people experience
Mm.
going to the dental office for a first time. Now, of course, we've created a beautiful space and, over 20 years, we've revamped it and refreshed it and all that. We just a year ago completed our wellness wing, where we have massage chairs and red light therapy beds and all, it takes time, but, at the core of this was a vision of creating a space where people can understand that this experience is about them and their goals, not about us telling you what you need. We don't actually say the word need here in my practice. So that whole mindset around what we are here to do, which is first and foremost to honor a person's truth and respect their autonomy, it's so outside the box of what I was trained to do in dental school. And it takes an incredible amount of patience. It takes a team of people who want to be that thoughtful and intentional, right? I mean, how many people in the world wake up every day and just go, okay, punch the clock, blindly kind of just do the motions, repeat it for 30 years and call it good. And, this is not the easiest practice to hire for, I'll be honest,
Mm.
because that's the first thing we talk about is like, how open to growth are you? Um, and what's that look like? So, I mean, you could probably get a sense as I'm talking about this, like I'm passionate about creating a space that is uniquely respectful of the patient or the guest or however you want to consider it. That in and of itself is enough. Now we could get into the clinical sides of how we had grown in technology over the past 20 years, from lasers to CAD CAM stuff to ozone to, neural therapy, all sorts of different biologically respectful modalities. Um, but ultimately it's just slowing down and recognizing that the patient in front of you is a human being with thoughts, feelings, and questions that only they know, and you won't have any sense of what that is without slowing down and asking questions.
Yeah.
When we do that, I mean, as you can tell by like our social media exposure and our growth there and our practice growth, it's like this is the dentistry every human being wants and nobody knows exists.
Well, do you know what? You've brought up a really interesting point, and I love the fact that, you really honor the person and the whole human. And I'm sure that's really felt every time you have a patient. And I love the fact that Mondays, everybody's new and they're in there. So everybody's in the same, I suppose, psychological state. And
Yes.
the one thing that I did want to ask, and it's brilliant that you have the background in psychology, because there is a particular state that I'm sure a lot of your patients come into. And what I find is, I'll speak from my own experience rather than anyone else's, is that I tend to only go to the dentist when there's an emergency or if I want to get my teeth cleaned rather than a prehab. It's more of a rehab, right? So when you're talking about, people come in and they'll have questions, I find that when I've gone to the dentist in the past, I go with the problem. I hand over the problem to the dentist and I just expect them to do it. And in a way, and this might be a personal thing, it might not relate to everyone else, but I have a feeling it might, is that I have been hesitant about asking more detail in case it
Mhm.
occurs like I'm trying to be a smart arse, or in case they might get offended, or and then I have a fear then of, well, I don't really know what I'm asking, so maybe I'm not going to understand the answer anyway. So we'll just let them get on with what they need to get on with.
Yeah.
Does that land with
Oh,
you, or do you find that?
yeah. So I'll tell you, there are some subtleties in language that, um, I can't tell you exactly why, but they are important to me and how I feel around communication. Um, I remember as an early dentist, or maybe even as a dental student, when a patient would say, "Well, whatever you think, doc," that now puts the ownership of the treatment decision on me, and I don't want to own it.
Mm.
I will not own somebody else's thoughts, feelings, behaviors, health choices. I want to, and again, this kind of comes into the experiences that we create here, which are highly visual, so that the human beings that we serve see the exact same things that we see, so it demystifies what we're discussing, right?
Mm.
Um, one of the first questions we ask people is, what are your goals for your health? No, I don't know many people that get asked that at any healthcare practice, frankly, right? They come in, well, let's look at your blood work. Out of the balance of subjective information and objective information, we tend to focus almost 100% on objective. Well, I see a crack in a tooth. You need X. You need a crown. There's like no or better yet, Karen. Here's the one that kills me. We you wanted your mercury out of your mouth, so we drilled it and filled it and put in composite. Now your teeth hurt because they did a lickety split and didn't take their time to respect the tooth anatomy and nerve health and all that. Now your teeth hurt. Guess what, Karen? I'm sorry. Now you need a root canal. And it's like, time out, time out. Can we start with what your goals for your health are? In 20 years from now, what would the best case scenario in your mind look like for great oral health? you know, and have them describe that picture. If I know what a person's endpoint looks like, then I can help design a plan that will get them there. And now they are moving towards the goals that they set for themselves. And I have no ownership of that. I'm just a support person. And that's really what I want to do, is help people understand they have that power. But, the power has been taken away from us in healthcare in so many ways, right? I mean, we could get into what's happened over the last 2 years. That's a whole different conversation, but,
Let's not
you
go
know,
there.
yeah, I mean, but so in dentistry, it's the subtlety of the language you need, and the person who is telling you that is an expert. Um, who are you to question them,
Mm.
Karen? Right?
And if I
It's that
did, I
it's
don't
that they
know
have the
that I would
power
know
over
the
you thing.
answer to. Mhm. Yeah. Yeah. Even if I
Yeah, and
did
I
answer
think
it,
it's like,
I don't know that I'd have the thing. Sorry, there's a little delay. Apologies.
oh yeah, no, 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 it's totally fine. You know, I think that if the spirit of conversation is based more on, what questions do you have? Then, you open it up so you can go, well, you know, what are all the options? I mean, frankly, a good healthcare provider is going to give you all of your options, even the ridiculous ones, right?
Mm.
Like, I love it when a patient's got a hot tooth. It's so mad. I say, look, the first option is you could do nothing. It sounds horrible, but you could do nothing, right? Let's acknowledge it. And then you could also do X, Y, and Z. Here are the pros and cons of all these, and what resonates most with you, right? Rather than, well, you need a root canal. Let's do it.
Mm.
So, and I don't mean to pick on root canals. It's just the one that I see so frequently. People feel like they have no other choice.
Yeah. Yeah. Or in my case, I had 2 teeth removed and I don't think they needed to be. But anyway, that's a whole other story. Um, I'd love to ask you, you spoke about mercury fillings there. And, a lot of people that are listening to this podcast will likely have a chronic illness diagnosis, probably multiple sclerosis. And, I've done a little bit of research, not a lot. So, and what I have found is that it can be linked to MS and your fillings and your dental health. Can you talk to us a little bit about that and what your thoughts, feelings, experiences on that?
Oh, yeah, and we could talk about that for hours. Um, well, one thing I would offer is, to the listeners, there's an academy that I'm a part of. I'm actually flying out to New Orleans tomorrow to go to their meeting. It's called the International Academy of Oral Medicine and Toxicology. It's the IAOMT. And you can look up their website if you want to go do a deep dive into the published research, which has proven the toxic effects of both mercury and fluoride. You know, go to town. Now we could go back to, um, the social understanding of Mad Hatter's disease over 200 years ago, and why, you know, people that were playing with with felt, and transdermally absorbing mercury and inhaling the vapors would go crazy. That's where the term came from, right? Mad Hatter's disease. So it's like, well, we know we've created a phrase around this, because it happens. Let's just go ahead and put it in your mouth, where you're going to breathe it in all the time. I mean, I remember in dental school, we were taught like, oh, it's completely safe. Now, mind you, on the box, there's like a skull and crossbones, danger, it's horribly unsafe. And when we drill it out of your mouth, our suction line system has to go through a multi-thousand-dollar mercury separation unit. So it's completely dangerous before it goes in your mouth and after it goes in your mouth. But by some miracle, it's completely safe in your mouth. And I want to share this. 2 years ago, right after COVID hit, I think it was like May of 2020, the American Dental Association put out a press release acknowledging, after decades of research showing that mercury vapor is constantly being given off in an elemental form that people then swallow and inhale, they acknowledge that, okay, we do see that that is a risk factor. We're acknowledging it's a risk factor. We still believe that for children older than 6 and I guess all people older than 6 years old, it's safe. But if you're under 6 or a pregnant woman, then it's not safe. Now, what about the 15-year-old girl who gets, 5 mercury fillings and then at 25, a decade later, gets pregnant with her first baby? How toxic is that going to be when that child experiences, a loaded dump through breast milk and, all the blood for mom? And I mean, it's like, we do not think holistically, right? Like, and that's just obviously that's a crazy concept. Now, on top of it, and I know you are specifically asking about mercury, but the other is fluoride. You know, the social medicine uh, drum bangers that like, oh, fluoride, it's the best thing ever. It's going to save all these teeth, which it does not. You know, over the past 50 years or more, we have not seen an effective reduction in, um, in decay activity, which has a lot more to do with processed foods and the, lack of nutrients and all this. But think about when you're brushing your teeth, forget about fluoridated water, which is also a massive thing to consider, but just through brushing your teeth, or when you go to the dentist and they put the fluoride on your teeth, the fluoride treatment, there's no way for that stuff to have an effect on your teeth without getting all over the oral mucosa, which is arguably the most absorptive tissue in your body. Maybe, maybe the lung tissue a little bit more, but people, why do we put nitroglycerin under the tongue when a person's having chest pain? Because it'll soak it up like it's IV, right? Uh, and people are exposing themselves to this on a daily basis, where these two substances have, significant neurologically damaging effects. All you have to do is go to PubMed, put in mercury, comma, MS. just start reading the hundreds of articles there that show the known impact on nerve tissues and other tissues as well, but particularly nerve tissue,
Mm.
Um, I could go on and on, Karen. I don't want to
Yeah,
take all
no,
day on that, but
it's
I
brilliant that you say that, and I think it's something that people forget about. A lot of the time when I get people coming to me, they want to know about the diet and exercise that I did to reverse MS, and we have like 5 pillars within our program. And it's funny, you said at the beginning of yours, we ask people what their health goals are. We do exactly the same because it's important. My idea of what somebody might want could be completely different, and I may have 10 of the same people. Sorry, 10 people with the same diagnosis, and they have completely different presentations of what it might be, and they've completely different goals. So everybody, even though it might be a similar program, people we personalize it to make sure that we meet the needs. And similar to this, so the question I want to ask you then is, say, somebody has been diagnosed with MS. They're probably in a stressed state because they're trying to figure out, okay, what should I eat? What should I do? There's many other factors, social, psychosocial, physical, and physiological. It, are they best going and finding a specialist dentist? Because, from my own experience, having them removed, not all dentists are keen on doing it because, they'll be like, oh, you're fine. That's what happened to me with the first 2 dentists that I tried. And I had to go
Yep,
and kind of
yep.
enroll somebody in taking them out and putting in composite instead. What would you say to someone
Yep.
that has mercury fillings, has been diagnosed? It could be, sooner, or it could be like years ago. What would you suggest they do?
Well, that's a good question. There's 2 things I wanna touch on there. I wanna touch on something that you said a minute ago, Karen, about, your experience in reversal of MS symptoms through diet and
Oh, it
exercise.
wasn't just that, by the way, but most people want to know.
Yep,
I had 5 different things or pillars that I did, but most
sure,
people want to know the diet and exercise because it's black and white
sure,
and you can see it, right? And you can measure it.
right. Well, and I wanna point out that diet and exercise both have massive impacts on your oral health, Like, if you think about first and foremost, you have to poop, right? I mean, like, you have to move stuff through your body to detox. You have to move your body to help that process occur, right? Like these simple things that, people used to experience on the daily basis, being outside too, right? Like getting outside, getting fresh air, getting sunlight, I mean, these simple concepts that it's so easy for us these days, myself included. I get in my little hole in the back of the office, I'm working on, helping people get their oral health improvement. It's like, I haven't moved today. I haven't been out in the sunlight, but these are foundational issues that are so critical to everything, including your oral health. So if somebody's super sedentary and um, they're eating McDonald's, 2 to 3 times a day, and they think that taking out their mercury fillings is gonna be the panacea, there's more to consider than just that, right? As to your point, it's a multifactorial thing to consider. So there's that, but, I will say, if you have mercury in your mouth and you are considering making a change, which there'd be a lot of reasons to do that, understand that, it is possible through that process, you may experience other tooth problems. It's just wise to recognize when you go put a drill back in a tooth, that nerve that got aggravated from being drilled and filled the first time or the second time, you know, the trauma to that nerve is cumulative. So it may reach a point where, due to trying to reduce the risk of mercury exposure, you're taking it out, but now you've created an inflammatory condition in a tooth, or you've exacerbated a fracture that was already present. Um, there's a lot of things to recognize that could be downsides of doing that before you dive
Hmm.
in, right? So once a tooth gets drilled on, it's all downhill from there, right? I mean, we do the best we can, but recognize like that damage got started the day that your diet wasn't awesome or whatever, right? So, but if you're going to remove it, do find a conscientious provider. That's the first step, in my opinion, is somebody who will listen, who will offer you all of the safety protocols. Uh, I mean, we had a woman in here yesterday from California who, she wanted the full bells and whistles, the head cover, the body drape, the, supplemental oxygen, the whole shebang. And it's like, chlorella, great. We've got it all here. But we are the kind of practice where I believe in allowing people to choose. So we give them a laminated list. Here are all the things we are going to do because this is where our comfort zone is. And here are all the extra supplemental things you could have. All you have to do is just check the box and say, yeah, I want the whole thing. And if a practice offers you that level of conscientious protection, you're probably going to do pretty well. It's also helpful if they are SMART certified, which is the safe mercury amalgam removal technique from the IAOMT. Um, that would be probably a good sign. I don't like to make any assumptions, right? Just because somebody went through a SMART certification program doesn't mean that they have mercury separation vacuums. You can jump through the hoops and not have any of that stuff. So I hate to say this, Karen, but I mean, there is false advertising out there, and I've seen many patients who have been injured from that sort of thing. So, know who you're going to. And then also, I would encourage you as the receiver of care to ask questions. What are my options for replacement? It doesn't have to be composite. And in fact, many, many teeth where the mercury amalgam filling is huge, it might be way more appropriate structurally to use some sort of a ceramic restoration. Um, but on the flip side of that, and this is super, super, super important. When I was in dental school, somebody would have a mercury filling in the bite surface of their tooth. So like 90% of their enamel is still intact. And let's say that tooth started to experience little fracture lines and, the darkness from the oxidizing silver and mercury and copper. They're getting into those cracks. So it looks gross, but structurally it's sound, right? And we were trained to tell patients, oh, got to have a crown, right? Time to crown it. And it's like, okay, so now we're going to strip off every last bit of enamel, which is going to inflame your nerve like you have no idea. And then they, stick a temporary on their tooth for 3 weeks, which exposes the open dentin tubules to all sorts of microbes because, temporary crowns are horrible and they leak, right? And then they come back and you glue the crown on and now, oh, my tooth is killing me, right? Now you need a root canal. And it's like, oh man, like, how can we even tell somebody what's appropriate for the health of a tooth before we take it apart? You know? So Dr. Nish and I, my partner here, we tell every patient, like, well, we think it might go this way, but we're going to take photographs as we go. We have intraoral cameras, high definition intraoral cameras. Every step of what we do, we take a picture so the patient can see this is what's happening with their tooth. And then when we finally decide, okay, here's what we think is most appropriate, they can understand that's why we're choosing that, this versus that. So, just be cautious of crowns is my point there, because once you can't grow that enamel back. Once you cut it off, it's gone. So be
Yeah,
thoughtful.
that's really, really valid points. Thank you. I wonder, like, from a daily perspective, you're saying like everything is so important and treating the whole human being, which is really important in my work as well, and taking people's lifestyle, whether they're sedentary, whether they're moving, their diet and everything else into account too. What would be your basics that you would say, like, without a doubt, make sure that you're doing this?
This episode of Talk Healing to Me is sponsored by Clean Boss, created by Joy Mangano, the legendary inventor behind the Miracle Mop and a pioneer in clean innovation. Clean Boss is a botanical disinfectant that kills 99.9% of viruses, germs, and bacteria. It's safe for food surfaces, soft surfaces, and baby high chairs with no toxic ingredients and no rinse required. It's also a degreaser, odor eliminator, and all-purpose cleaner that works as hard as the chemical-heavy stuff without the health risks. Check it out at getcleanboss.com/Karen for a clean, better, and living safer life?
Yeah. Oh, great question. Um, well, again, I see the world through the eyes of a holistic dentist, right? So,
Is that through goggles?
so I'm, well, I will say this, over the years, and particularly through the 2-year board certification program I did in integrative medicine and dentistry, one of the things I came to appreciate, and I say this for myself more than anybody, is taking time to enjoy your life. Like finding time to bask in the joy of parasympathetic energy. And again, I say this more for myself than anybody because I'm like, woo, let's go. Like there's more things to learn. This is exciting. But, you know, um, it's so important to take time out for the things that you enjoy and the people that you love because, they might not always be here. And go figure, when you get into a parasympathetic state, the nature of your blood pressure changes, the nature of the saliva that you form changes, the protective nature of what happens in your teeth. Like you literally develop fluid flow from inside the teeth out, which pushes the crap that gets into those tubules of the dentin out of your teeth so you don't experience, sensitivity. Whereas when you are under fight or flight, sympathetic, go, 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 you have the reverse nature of fluid flow, right? So it's such a dynamic and complex experience through our mouths, and we pay no credence
Sorry,
to it at all.
you probably saw my face there. I'm like open jawed.
Yeah.
Sorry, I'm gonna
Yeah.
recreate what you said. I'm possibly butcher it.
Yes.
There's fluid coming out from your teeth, out from your teeth, so not from your salivary glands. Really?
Right. Well, and your salivary gland. Well, think about it. So you have, teeth are not
Yeah, they're porous,
bone,
right?
right? Every tooth. So teeth have 3 layers, which is like we don't all we see, you and your beautiful smile. I see all of your lovely enamel, right? You have good, beautiful enamel display, Karen.
Oh, I
Um,
thank you. What a chat up line.
yeah, exactly. I love it. So that's the first layer, and that's what we are accustomed to thinking about when we think about teeth, but that's only about 20% of your tooth. So the majority of your tooth is called dentin, or if you're in Australia or New Zealand, dentine, right? Depending on where you are. And it's completely porous like a sponge. So when your tooth is healthy, the third layer, which is actually an open space within the center of the tooth that has little tiny nerves, like you get cold or something and whoo, your tooth feels cold. It's got nerves, it's got little arteries, little veins, little lymphatic vessels. Like that all lives inside of the tooth. It's a living organ. And of course we just drill it and fill it like it's a piece of wood, like, oh, there's the hole, drill it, put some wood, wood putty in there and call it good, right? And of course we can do that with today's technologies so that you don't even know it's there, right? Like to the eye, it's, composites, porcelains, like you could have all this restorative dental work. And we see this all the time, but people have 10 root canals. They literally have necrotic, corpse teeth in their jawbones, yet they're covered with these porcelain caps so that they look perfect. And it's like they're dying inside, literally dying inside, but it looks perfect, and it's a real challenge in today's modern dentistry. What we can do doesn't necessarily equate to what is most appropriate for a
Mm.
person's best health.
The question I want to ask you around that, because it's so interesting, and I saw a post on your Instagram feed, and it was a picture of a knee that was swollen. Now, that's all that I know. But you then
Yeah.
related it all the way
Yep.
back to particular teeth. And so what I want to ask you about that is, how do you know? Because if something presents in a different part of your body, how then do you group that all together? Because if you go to your doctor, and you're like, okay, I have a sore knee, the likelihood is you're going to get anti-inflammatories or go to physio. How then do you distinguish or know
Yeah.
when to go to a dentist? Because honestly, it would not occur to me.
Yeah. Well, I'll give you an example, and the truth is, unfortunately, Karen, that it doesn't happen. Um, not and there's 2 reasons. One is ignorance on the part of the dentist primarily, because we're not taught this stuff in school. I was not. The way I have come to appreciate and understand as much as I can, I don't fully understand anything, right? Um, is through listening to patients and observing what has gone on with their health experience. So let me share with you a story. I mean, I could share a lot, but I'll just give you one in particular. This woman that I'd seen for years had an upper left molar, had a root canal, it abscessed, we extracted it, and she opted to have a dental implant placed. Now, at the time, this is probably 5 to 6 years ago, it was right before I had discovered ceramic implants, which by the way, were brought to my attention by a patient who had wonderful questions, right? I'm like, time for me to be humble here. I don't know what that is, right? So anyways, we put in a titanium implant, just thinking like, hey, sure, titanium, it's good for anybody, right? Um, Within a month, her skin had broken out in all sorts of hives and lesions. So who did she go see if her skin breaks out? Dermatologist, right? Oh, that's weird. My skin's broken out. Uh, which is totally understandable, by the way. Your skin breaks out, you go see the dermatologist. So they're like, well, your skin's broken out. Of course, in our Western model, we don't look for the cause. We just tell you, take these pills and these creams to mask symptoms so that you look normal. Sound like what I was just talking about with crowns and root canals, right? So as long as you look fine, you must be fine, right? So I don't know how many months went by. It might have been, I think she just kept suffering. And finally, she had a gut sense. And by the way, when a patient says, I feel like, or my gut sense is, and we just shut up and listen because, like, here comes the truth, right? Um, so she came in months after the implant had been placed, and she shared with us what she had experienced. And I was like, well, I can't say for sure whether it is or it isn't the implant. I don't know that, but it sure seems like, you know, a, a, a good correlation. I feel like it's a minimally invasive thing to do to go ahead and take the implant out. Okay. So she agreed to it. We took it out. Within like 3 weeks, all the skin symptoms had completely cleaned up. Right. Um, and this is it. By the way, it does not only happen because somebody's going to hear this and think, oh, titanium implants bad. That's not true. Many people can experience implanted titanium and do absolutely fine with it. Some people cannot. The point is, like, understand your risks, know that you do have options, and, you know, ask about those so that you can make a choice that's best for you based on your goals. Um, so things like that. I had a fellow up here a month ago. He had flown in from Trinidad and he had a bunch of mercury in his mouth and a severely abscessed molar from a root canal. And I just texted with him last week. So it's been 3 weeks. And I mean, head to toe, horrible eczema. His head, his arms, his legs, not in the trunk, interestingly enough, but just in the 3 weeks since we extracted the tooth, put in a ceramic implant, and got all the metal out of his mouth, he said all the redness has gone away, the flaking has stopped. I mean, it's just incredible. But it makes perfect sense that if we're constantly exposed, like chronically exposed to infection and or materials to which we're sensitive that disrupt energetic flow, it's going to create problems. Unfortunately, we're just not trained yet to think about how the mouth could be connected to that. I suspect, as you might be well aware now, Karen, that we're going to see more and more of this because there is the power of social proof, social media. I mean, there's a lot of garbage in social media, but there's also some good stuff out there. And at least even 80% of it's garbage, but 20% of it brings about awareness. That's moving
Hugely
forward, I
so.
think. So hopefully more and more dentists will become open to, not to say that everything we were doing before is bad. There's a lot of it that's great. But what about those things that isn't working for a certain percentage of your patients? Becoming open to the idea that maybe there are other things we could consider, and perhaps I could
I
ask more
love that. That's
questions.
really, really great. And really, empowering the patient to become more educated, on this. And look, we have a whole host of things that we can. In fact, I want to bring up your Instagram. You have a Toxic Tuesday and a Wellness Wednesday, which I love. Can you share with us your Instagram profile, actually, please? Because I know you have a certain goal around that, right?
Oh, yeah. So my it's at Blodgett Dental Care. It's Blodgett, B as in boy, Lodgett Dental Care. Uh, and my goal is to gain well more than 1 million followers who of people who are passionately interested in better understanding total health. Um, we started 3 years ago sharing patient recovery stories. Uh, I had a team member named Mara who had been, suggesting that I look into Instagram. And at the time, my two daughters were young teenagers, and all I saw was just the toxic social garbage, that they were seeing on Instagram and social media. And I was so opposed. Yet turns out, as I now understand, it can be a wonderful way to connect with people. Um, and amazingly, we've gone from like 200 followers 3 years ago now to over 66,000. And, every day we're growing. Thank you very much. Primarily through the energy I put into sharing stories, and the bravery of those patients who've
Mm.
allowed me to share their stories. You just mentioned one of them, a fellow named Colin, who, came to us sharing his experience about, he was telling Mara actually, a few years back now about like, oh, I had this crazy knee thing happen. And she started asking him about, his oral health. And we took some records and, a 3-dimensional cone beam scan. And we found this abscess tooth that's on the same energetic meridian as his knee. And he made the connection about how he had had severe pain around that tooth like a couple weeks prior to the knee incident. And we're like, well, I mean, I can't say that it is or isn't connected, but gosh, based on what we understand, it surely seems connected. And he was looking at having surgery, right? So we get the tooth out, clean it up, let his jawbone heal up. Knee's fine. It's been like 3 years now. Uh, yeah, I'm actually going to be seeing him next week. He lives in Minnesota. Uh, I'll be helping rebuild those spaces now with some implants, and he's a movie and video producer. So we're going to record the whole thing and, show how we go about rebuilding his dental spaces with some ceramic implants and got using guided techniques and such. It should
That's
be a cool story of
fascinating. That's
recovery.
fascinating. There's only two holistic dentists that I know of in Ireland. I'm sure there's more. That's only what I know. And the waiting lists are phenomenally long. So we need more in the world. Yeah, phenomenally
I
long.
know.
And
Yeah.
do you know what? The information that
Yeah.
you've provided is really, really helpful. And I really encourage people to go and check you out on Instagram, because the stories that you share, but more so the information that people can empower themselves, so that they can go to their dentist. Because look, you know, people go to work and to train, and you get into doing what you're doing. It's not to try and, um, paint any dentists with, a massive sweeping statement and say they're not, doing potentially what they should be. Research updates all the time, and it
Right.
just might be,
Right.
outside of that. So it's really great to be able
That's
to do
right.
that. I have some quick fire questions for you. Are you ready for them? I have to put on my glasses to read them. Hang on.
Surely.
Oh my
I
goodness.
I
All
understand
right.
that.
So you're
Yeah.
quick fire round. So this is where you'll just provide quick answers to these, right? So if you followed your childhood dream, what would you be doing now?
Oh, um, I'm living it. I always knew I would become a doctor of some sort and be a musician. Um, and that's, I mean, I live this probably 14 to 16 hours a day, I'm engaged in oral health stuff. And when I'm not doing this, I play in a band and, we I've been playing music for 45 years. It is my life's deepest passion. Thankfully, a few times a year, I get to go play for people and, you know, it truly brings me joy. But yeah, like, strangely enough, this is what I envisioned as a child.
That's beautiful. Do you play an instrument or do you sing?
I do all of that: bass, guitar, drums,
Yeah.
keyboards,
Do you have a favorite song to
saxophone.
play
Yeah.
or sing to?
Whatever
So
song I'm
good.
playing is my
We have
favorite song to
we have
play.
a neuromusic therapist coming onto the podcast really soon, so you should take a listen to that. Yeah, it's really cool.
Oh,
Okay, great.
awesome.
Number 2, what advice would you give to your younger self?
Ready to turn inspiration into transformation? Join the Inner Circle Book Club, where we explore life-changing books that spark energy, confidence, and joy. Each month, we read, reflect, and challenge ourselves with exclusive coaching, powerful insights, and engaging discussions. It's more than just reading, it's about real change. Join us with the link in the show notes and get ready to start your next chapter today. I look forward to seeing you on the other side. Let's grow together.
Um, Slow down,
Oh,
breathe
nice.
easy.
Very nice. Okay, number 3, who inspires you most? I know, sorry.
Oh, wow. Golly, I gotta say, I mean, that's a tough one. Well, I mean, in many ways, in my life story is, Jesus Christ inspires me more than anybody. It's through coming to Jesus that I made this turn in my life. I mean, I was admitted to a master's program in 2 months from starting it, and I pulled the ripcord on everything I had set my plans to because of how Jesus took my heart and showed me a different path that I was meant for. Um, but I will say I have been so blessed by numerous mentors. I could go on forever about, um, the mentors who have helped me see what I see and give me shoulders to stand on so that then I can be shoulders for another person who will come behind me. And I will also say I am so inspired by my parents. They've been married over 50 years and are the most loving, supportive parents. I mean, I'm super blessed. And I have to also shout out to my wife, we've been together 30 years. And,
Hey,
it's
congrats.
thank you. It's She is an incredible human being. Um,
Oh,
just a heart of goodness.
that's so beautiful.
I'm pretty
Thank you for
fortunate.
saying that. You are. That's really
Incr
great.
Yeah,
All the gratitude. Really cool.
yeah.
Okay, so number 4. So, do you have a particularly dark day that you experienced that was difficult at the time that you learned a lesson from and it actually turned into a positive?
I'll share one that relates to dentistry because it's so, I mean, like most human beings, I've had many a dark day.
Mm-hmm.
Um, I had an experience, and this is one of the most powerful influences that steered me into this realm of holistic dentistry. My father came to see me after he had been seeing my twin brother. I have an identical twin brother who's also a dentist, and at the time he was, living across town and had a practice there. So my dad was seeing him, my mom was seeing me, right? But my brother moved to Texas. So then my dad comes in to see me, and my brother's practice at the time, they did not have a 3D cone beam, system. So, my dad who has suffered with dental issues his entire life, came to see me. We did a cone beam scan, updated his records, and we observed. Now imagine this, all 4 root canals on the left side of his head were root canaled, and the upper 2 were severely abscessed. And to make matters worse, those abscesses weren't draining out the side where he could swallow it, which is kind of gross, but it was actually draining into the roof of his mouth where his lymphatic system was then draining it down the lymph chain of his neck. And, I looked at that through the eyes of the understanding I had at the time and said, geez, Dad, like this looks really scary. These teeth are clearly severely infected. It would be wise for your health to get these out. What would you like to do? And of course he's like, what am I going to chew on? They don't hurt. Understandable feelings, right? Um, Within the next year, as he was, chewing on the idea, pardon the pun, um, uh, he was diagnosed with non-Hodgkin's lymphoma of that left cervical chain. So when he, thankfully he shared the name of his oncologist with me. I reached out to that oncologist. We reviewed the findings of his cone beam scan together, and I shared with him my thoughts and concerns about these teeth. And thankfully he was 100% on board with me. And he's like, yep, these things have to go before radiation. So, because of not dealing with a chronic known infectious issue, my dad had to go through some really rough radiation therapy, right? Which I cannot say, right? I can't say that, well, he removed the teeth ahead of time, he could have avoided that. Certainly he could have. I can't say that conclusively, of course, but
Mm.
I do see these connections. Now, when you get a phone call from your parent telling you, I don't want you to be overly concerned, but I was just diagnosed with cancer, it's like, uh, okay, how can I be more proactive to help other people since and again, like, do I do anything differently today? No, I still inform people. I give them their choices, but I do share that story, um, because that was a scary time. And the following year, as watched him go through that process of radiation therapy and whatnot, it
Mm.
was scary times. Thankfully, I mean, that's been maybe a decade now almost. He's doing pretty well, thankfully. But
Thank
um,
goodness.
yeah, I will say after that, he got pretty inspired to get out the rest of the mercury and the root canals. And now his mouth is energetically balanced and there are no more toxic materials. There are foreign materials. It just happens to all be ceramic. What was interesting is that after we got all the dead teeth, which there were like another 4 teeth in his mouth that were dead teeth, his hypertension went away, right? He found himself having like low blood pressure because his doctor was still medicating him as though he still had a toxic load. And once it was gone and his body healed, he didn't need that crap anymore. So it was really a dark time that ended up having a much better ending. But that was pretty scary and massively influential on me as a provider.
Hugely so. Also, I'm a little bit hooked on the fact that you have an identical brother who's also in dentistry, and your mom and dad split up, and you both went to each other. Like, I would love to have been a fly on the wall to hear how you both organized that. That's so cool.
Yeah,
That's so cool.
yeah,
Like, that's
yeah.
a movie.
It,
That's a
yeah,
movie.
it was. Well, and I tell you, like between my brother and me, you could do a show on the two of us. He's a hysterical guy,
Oh, I
just a
love it.
loving, warm human being.
I love it. And I'm picturing you amalgamating your hobby and your profession and like singing to people as you're giving them dental treatment as well. Just there's an idea. You're welcome to it.
Yep.
Okay, so question 5. What does your ideal date consist of? If you and your wife are going out on a date, what's your ideal one?
Oh, we tend to keep it pretty simple. Um, and thankfully in Portland, Oregon here, we have phenomenal restaurants. One of my favorites, and through the chapter of having children, we don't do this very often, but before we had kids and we're about to become empty nesters in a year and a half, we used to go to the gym and work out together and then get showered up in the gym, and then we go have dinner and just talk. And, it's so funny. We have been together over 30 years and we still learn new things about each other. We are so different. And I've always said that, she helps me see the world through a lens that I do not own. And it's such a blessing, even though I sometimes find it challenging. Um, it's such a blessing to be able to receive her perspectives and think differently. So it's probably that, right? A workout, a shower up, a go have dinner, and just connect.
That's
It's
beautiful. I hope she listens to
yeah.
this podcast now. You've got to make her listen to it so she hears that. That's really great. A
Absolutely.
perfect segue into question number 6. This might be an Irish one, right? So I hope that you understand this. So if you had a roast dinner, which would be like roast potatoes, carrots, some kind of
Oh,
protein, and
yeah.
stuffing, do you eat your favorite thing first, your favorite thing last, or a little bit of everything together?
Ooh, I hate to admit this. This I'm sure this speaks to me, and this is one of the ways in which my wife and I are so different. I tend to be more of a sectional eater, So, like, come Thanksgiving, which I know is not an Irish holiday, but in America, when I've got my mashed potatoes and my turkey and my stuffing and my cranberries, like they all have their own little space, my organized plate. Whereas my wife is just piled on, right? It's all one pile. Um, But I tend to eat like a bite of this and a bite of that and a bite of that. I don't necessarily go through one thing first, then another thing. Uh, Probably a bite at a time, but they don't generally touch.
Interesting. So you almost like what's I used to get them anytime I go into a particular restaurant in Dublin where you'd have like it's an Asian inspired plate where you'd have everything separated and a dessert. I can't remember the
Yeah,
name of it
yeah,
though.
right.
Like
I
that.
know what you mean.
But
Well,
do you
yeah.
put everything on a bit of everything on the fork or do you eat each ingredient separately or each part separately?
It, like I'll mix my cranberries with my turkey, but not so much my stuffing or my mashed potato. I want to eat those separately.
Okay, so you wouldn't get like a bit of turkey, bit of mashed potato, bit of
Oh no,
stuffing. You wouldn't put that all on the same fork?
not this guy.
But like, is that not what a chef like does to make sure that all the flavors marry together? I wonder, is it a
Yeah,
dentist
I don't
thing? I
know.
wonder. I'd like to ask all the dentists that. Okay, cool. Very interesting answer. I like that. Okay, number 7. If you had to choose 3 people to join you for dinner, can you see there's a theme here? Dead or alive, who would they be?
Oh man. How oh my goodness. Um, how do you make a list that short,
I
Karen?
know, sorry.
Okay, okay. You'll like this. One would be Bono,
Really?
right? My favorite band.
Okay,
I mean,
nice.
favorite band. And I've loved observing them throughout their growth. Um if Jesus could make it, that would be amazing. Um Who
Bono
else?
sometimes, sometimes we think that Bono might actually call himself that. So maybe
Yeah,
that could
yeah,
be a
yeah.
2 in 1. Sorry, that's terrible. I do love Bono,
Oh
but
my gosh. Yeah. They made an impact for sure. Oh my gosh. Who would 3 be? That's just so I mean, I think of so many people, Karen. Um, George Washington.
Okay. All
That would
right.
be an interesting guy to ask some questions.
I mean, Bono, Jesus, and George Washington. I mean, surely they would come out with a new currency with pictures and stuff on them. I mean, that would be a
Right?
good currency, right? Okay, really
Yeah.
great. That would be a really interesting dinner. So, number 8, favorite song. I kind of asked you this a little bit, but you're going to have to choose one.
Oh, golly, you're killing me. Um, uh, I have to say, like, if I need a uplifting song, I listen to Revelation song by Phillips, Craig, and Dean. It is one of the most inspiring songs ever.
Okay.
Um, there's also, because of, I have like every song I listen to is like, oh man, I love it. I love it. As a musician, right? I'm just a music appreciator. But and totally blanking on the name of the Bach song that Yo-Yo Ma plays on the cello. I can't remember what prelude that is, but it's just magical to listen to Yo-Yo Ma play that thing.
Okay, nice. No, I'm going to send you a song after this, which I adore. I have 3 favorite pieces of classical music. I'm going to send them to you afterwards. They're beautiful. I
Please,
think you'll
please.
appreciate.
Thank you, Karen.
Sure. Okay, number 9. What is the book that you gift the most? And considering it's World Book Day today, well, it is in Ireland anyway.
Thank you. You know what? We gift at the practice The Dental Diet by a guy named Stephen Lynn in Australia, or a dentist, not a guy. I mean, he's a guy, but he's a dentist in Australia. And I've spoken with him a couple times via FaceTime and whatnot. Great book. It reviews Weston Price's research and then gives a kind of a condensed, more simplified understanding of that information. And then he provides all this practical recipe ideas of how to eat for great oral health, which turns out is also equivalent to great systemic health. And we order up a lot of copies of that and share that with so many patients.
Oh, really great. I'm definitely going to look that up. And then finally, number 10, how do you switch off?
Oh, yeah. 100% either in my office or in my music room at home. I go in, I grab whatever guitar looks inspiring to me that day, and I turn on and I turn up and just let the vibrations of the music wash over, and I just jam, and when I can, I get together with the guys in my band and we rock out, and that is my most favorite decompression mode.
Amazing. I love it. I love it. You have been so generous with your time, knowledge, experience, sharing it today, and I really appreciate it. Thank you. And
oh, thank you, Karen.
yeah, you're so welcome. I would love you to share with people, where can they find you? Where can they get more information? Tell us where.
Sure. Thank you very much. Our website is blodgettdentalcare.com. And we've already got it spelled out once.
Yeah. No, that's awesome. And then you're on Instagram. We want to get that following up. Are you on YouTube or anything else?
Yes, please. We do have a YouTube channel. If people go look me up, I've been interviewed a number of times in different contexts. Some people ping me on Instagram. They're like, "Hey, what's the best way to get my tooth out and recover well?" And it's like, well, I was interviewed by the IABDM, International Academy of Biological Dentistry and Medicine, a couple of years ago, and I went through my whole protocol, which is pretty awesome and fun and technologically driven and respectful of biology and all this, right? It's really cool. And we're still doing it today.
I want to go nerd and listen to that.
Oh yeah, it was a good one. And it's, it gets you to thinking about how do you help the body heal, right, to its best capacity. So yeah, our website, Instagram, and this is one thing I would ask, when people go to Instagram and they start following us, you would do my heart good to share our handle at Blodgett Dental Care with every human being you know.
I love it.
That is how, and I say that because when enough people become informed and empowered, and they start asking their dentists, and the dentist hears it enough times, they will finally start to see that there is a reason that they might want to go and learn more. It will not happen by trying to push this information on dentists, I'm sad to say. It has been tried for 50 years with this technology and that technology, and it's like, most people don't care. It has to come from the desire of the human beings that walk in our doors and say, I want this. When patients say, I want this enough times, we start to pay attention, because usually, let's be honest, it means they can make a better living, helping provide a better standard of care, and then everybody wins, and that feels great,
For sure. I like it. Get a movement going. Dr. Kelly Blodgett, it has been a joy. Thank you so much for your time.
Thank you, Karen.
Thank you to our sponsors of this episode. You can visit getcleanboss.com/Karen. And also a thank you to our video and podcast producer and editor, Aoife McNamara at Imagine Media. Thank you. Thanks for tuning in to Talk Healing to Me podcast. Sometimes the right piece of info can totally change someone's health journey. So if today's episode resonated with you, please pass it along to someone who might find it useful. And hey, if you enjoyed it, don't forget to like, subscribe, and perhaps even leave a review. It helps more people find us, and I'd love to hear what you think. See you next time, and until then, keep healing, keep growing, and keep listening.
Blodgett, a biological dentist in Portland, Oregon, and you are listening to the Talk Healing to Me podcast.